there are a number of different diseases that have been associated with boron deficiency, and cancer being a big one. So in the case of cancer, prostate, cervical, as well as lung cancers have been linked to boron deficiency. We've also got osteoporosis, as we mentioned, many mechanisms of regulation with osteoporosis, right? There's a calcium, a magnesium, vitamin D, and then boron itself, important for the matrix of bone. So these things all important for bone health as well as arthritis. Studies show that boron supplementation actually reduces pain, but also can reduce the risk of the development of arthritis in the joints. Oh, let's back up here. Got a couple of studies to show you on this. So you see here the essentiality of boron for healthy bones and joints. In this study, since 1963, evidence has accumulated that suggests boron is safe and effective treatment for some forms of arthritis. You see down here, the initial evidence was that boron supplementation alleviated arthritic pain and discomfort. It was followed by findings from numerous other observations, epidemiological and controlled animal and human experiments, to include these different things, the findings. So one, analytical evidence of lower boron concentrations in femur heads, bones, and synovial fluid from people with arthritis than from those without. So in other words, they looked at the concentration of boron in the actual bone. The femur is the head, the tip of the hip bone, the other bones as well, but also the synovial fluid. In people with arthritis, they had lower concentrations of boron than people without arthritis. So that was one observation. The second observation is evidence that bones of patients using boron supplements are much harder to cut than those of patients not using boron supplements. So that also an interesting observation. And then number three, epidemiological evidence that in areas of the world where boron intakes usually are 1 milligram or less per day. We go back to that number, right? 1 milligram or less per day. The estimated incidence of arthritis ranges from 20 to 70%, whereas in areas of the world where boron intakes are usually 3 to 10 milligrams, the estimated incidence of arthritis ranges from 0 to 10%. I mean, those are whopping numbers. And then we have experimental evidence from a double-blind, placebo-controlled boron supplementation trial of patients with osteoarthritis, a significant favorable response to a 6 milligram boron a day dose supplement was obtained. 50% of subjects receiving the supplement improved compared to only 10% receiving the placebo. So again, in this study, 6 milligrams of boron per day, half the study participants improved over placebo. That's pretty profound when you consider the alternative. What are the alternatives to arthritis or arthritis medications? So you have drugs like NSAIDs, and then you have drugs like acetaminophen, which are, these are the over-the-counter remedies for pain, for joint pain that most people will generally buy. NSAIDs would include drugs like ibuprofen and aspirin, naproxen, etc. And then acetamin would include drugs like Tylenol. But your NSAIDs, what do? They damage the gut lining, causing vitamin C and iron reduction or deficiencies. And of course, you need both vitamin C and iron for healthy joints as well. So, I mean, you're treating the pain while increasing nutritional deficiencies that can create the very thing you're trying to treat. And with acetaminophen, the big problem here is that it causes glutathione deficiency, which can lead to liver problems. That comes with its a whole host of different types of issues. And then beyond the over-the-counter, so again, these are over-the-counter options for arthritis, but what are your other options? I mean, you've got other really, really strong pain medications, the opiate class of medications, which, hopefully none of you are treating your arthritis with that, but I wouldn't be surprised to see many doctors writing these scripts for people that they shouldn't be writing them for. But I mean, those types of drugs are horrific. I mean, aside from the risk of addiction, they shut down the GI tract, causing the severity of constipation and other health problems. So not really a great option on any of these fronts. But what can we do? We can go to something as simple as boron. And, again, in the study, I showed you 50% of the patients improved. So only at 6 milligrams a day, which is, pretty safe to do. All you have to do is try it. I would encourage any of you struggling, trying to look for a natural alternative. I would consider using that boron as a potential to aid and support your joints. We also have this one, boron-containing compounds as a preventative for chemotherapeutic agents for cancer. So as I mentioned earlier, cancer, you can see here types of cancers most frequently impacted by boron-containing compounds include the prostate, breast, cervical, and lung cancers. Mechanisms involving boron activity on cancer cells are based on the inhibition of a variety of enzymatic activities, including serine proteases, NAD dehydrogenases, mRNA splicing, and cell division, but also receptor binding mimicry and the induction of apoptosis. Apoptosis being the term for programmed cell death. So this is where your cells kill themselves, commit suicide. This mechanism is how we fight cancer, one of the primary mechanisms of how we fight cancer. And then boron-enriched diets resulted in significant decrease in the risk for prostate and cervical cancer and decrease in lung cancer in smoking women. Boron-based compounds show promising effects for the chemotherapy of specific forms of cancer, but due to specific benefits should also be included in cancer chemotherapy or preventative strategies. So those of you with cancer, talk to your doctor as to whether or not supplementing with boron might be right for you. Or don't talk to your doctor and do it anyway. The good news about boron supplementation is there are no known interactions with drugs. So again, very, very safe to take. Anything really under 10 milligrams a day is really safe to take without any known drug interactions or problems. Now, how can we eat more boron? Because that's going to be important too. And this is, a lot of times I pick on plant-based diets. You guys might hear me sometimes sound like I'm biased more toward heavier meat than plant, and that's not true. I'm more of an equal opportunist, meaning I think we should eat plants. I think we should also eat animal tissue, and I don't think we should just strive for one or the other. I think some people have had success on either side of that equation, but I think the vast majority of folks need both. And boron is one of those examples where you don't get a lot of boron in meat. So if you really want to get a good amount of boron in your diet, I've got a list here of different foods that are highest in boron, and you'll notice the trend here is these are all plant-based foods, right? So avocado, apricot, currant, prune, raisin, peaches, grapes, apples, pears, red kidney beans, lentils, almonds, etc., and a number of other nuts over here on the far right. And then one or two give you kind of just how much is in these foods, right? So if you look here, this is a great research review that published kind of a chart explaining how much boron was typically found in a serving of these different foods. And so you can see in this diagram, avocado very high, 2 milligrams of boron in a typical serving. Apricots, 0.5 milligram, currants, 0.26, grapes, 0.5, etc. You see down here, red kidney beans, almost 2. So again, the problem is many of you are gluten sensitive. If you're listening to my show, we talk about gluten all the time, and a lot of you are gluten sensitive. And not that any of these foods contain gluten, but many people with gluten issues have digestive struggles. Their gut's damaged, and they don't do real well with eating a lot of lentils or bean-based foods because they're hard to digest. And if your gut's already damaged from years of gluten exposure, that damage makes it really hard to tolerate these types of foods. So many of you don't tolerate those. So just be aware of that and look at some of these others as an option. Now you'll see down here on the bottom that wine also, Shiraz wine, contains a lot of boron as well, but this is not wine that I would say I don't really recommend trying to drink a glass of wine every night to get your boron for reasons that alcohol is toxic and causes nutritional loss. So in my opinion, trying to obtain it from alcohol would be a bad idea, but nonetheless, it does have boron in it. Okay, should you supplement? Possibly yes. I'm a big fan of this. Get tested. right? Get tested. Ask your doctor to test you. Because by getting tested, not only will you have a baseline, but then you'll have a way to measure as you go forward in the future the effectiveness of your supplementation and the potential as well to reduce the risk of any kind of toxicity that could come. Although boron is relatively safe and non-toxic, with reasonable doses, again, getting tested, everybody's different. Everybody's unique in that regard. So getting tested might be very, very helpful. Now, 3 milligrams a day is generally really, really safe. A lot of studies show that anything, so kind of staying under 10 milligrams a day is really safe to do. Now, if you look at, this is from National Institute of Health in their dietary supplementation upper limits. So you can see the tolerable upper intake levels for boron if you're 19 years of age or older is 20 milligrams a day. And that's both for male and female. And you can see for teenagers, it's 17, and then for 9 to 13, it's 11 milligrams a day. For 4 to 8-year-olds, 6 milligrams a day. 1 to 3-year-old, 3 milligrams a day. And then, for 7 to 12 months, there's no established upper intake. So there's no real data that they have that they share. Although they do have this little, you can see down here, breast milk formula and food should be the only sources of boron for infants. So if you're talking about infants, they don't really recommend any kind of supplementation. So that would be these two groups right here. But if you're an adult, 20 milligrams a day. Look, if you're like most Americans, your diet is going to contain approximately 1 milligram a day, and you got 19, so you've got an upper intake level of up to 20. Most people get 1 a day, so if you're staying around 10 a day, most of the research studies on arthritis and bone loss and regulation of hormones is somewhere in that 5 to 10 milligram range. So again, if you're trying to get therapeutic benefit from using boron, that's a pretty safe place to be. But as I mentioned earlier, it's always a good idea to be tested and to be monitored. Now, let's talk if you're on it, these are things you can pay attention to. So is there a toxic level? Yeah, there can be. And so generally speaking, nausea, vomiting, diarrhea, most of this is GI tract symptoms, right? Skin rash can also occur, as well as lethargy, which is a generalized fatigue, and then accelerated loss of vitamin B2 in the urine. So if you are being tested, this is one of those where you might see your B2 start to drop, and B2 deficiency will cause something called photophobia and something else called chelosis, which is basically chapping of the lips. And so if you're on boron for a long period of time and you've been popping, 10 milligrams a day, and you start becoming really, really sensitive to bright light, your lips start getting really, really chapped, you might consider that you're taking enough to deplete or to cause an accelerated excretion of vitamin B2, which could lead to those symptoms. But again, also paying attention to some of these other symptoms as well. So if you're going to take it in higher doses, it's never a bad idea to measure it, never a bad idea to monitor it, never a bad idea to know what are the potential symptoms that you might experience should you be getting too much of it in you. So if you've got questions about boron, leave them below and make sure you join us for live Q&As every Thursday night. Thanks so much for tuning in to Dr. Osborne's Zone.